Good morning, everyone. I am Dr. Midun Matthew, member of Clinical Research Forum. It is my pleasure to welcome you all for today's session on an essential and thought-provoking topic in the field of research, bias in research. Before we begin, I would like to take a moment to introduce our speaker for today, Dr. Haritha S. Nath. Dr. Haritha S. Nath is an assistant professor at School of Pharmacy and Research by Gyan Prasad Global University. She is also the dedicated faculty advisor for the ISPER DPGU student chapter. She is the lead for Clinical Research Forum of FCPI. She is actively mentoring and guiding the students in the fields of pharmacoeconomics, pharmacovigilance, and also outcomes research. With her strong academic background and commitment to research excellence, she has been instrumental in developing a research-oriented mindset among the students. We are truly fortunate to have her with us today. Coming to the topic, bias in clinical research, it is a fundamental concept that every healthcare professional and researcher must understand. Bias, whether intentional or unintentional, can significantly influence study outcomes, affect data interpretation, and ultimately impact patient care and decision making. Understanding different types of bias and ways to minimize them is crucial for ensuring the validity and reliability and ethical integrity of a clinical research. I am confident that today's basic module session will provide us with valuable knowledge and practical understanding that we can apply in our academic and professional journeys. Without further delay, I would like to invite Dr. Haritha Nath to take over the session.
Thank you, Dr. Midun Matthew, for this nice introduction, and thank you, FCPI, for this wonderful opportunity. So, without further delay, I will move on to today's topic, that is bias in research. So, already as Dr. Midun has explained, it is like very crucial to understand what are the biases happening in research. So, like when you are conducting a research, there are multiple procedures to follow. Like you have to frame a question, then you have to select a study design, sampling method, inclusion and exclusion criteria setting, and there are a lot of procedures following till the end of the publication and dissemination. So from the first to start, there can be many deviations in the research, or else there can be errors in research due to sampling or many other reasons. So these whole things can be termed as bias. So whenever a bias occurs, there will be a deviation in a result or a negative consequence. So moving on to the next slide. Learning objectives. So today what we are going to learn through this basic module. So first one, it is like define bias in research and explain why it affects the validity of findings or how it will be affecting your findings. Then describe how bias occurs at different stages of research. So from the sampling techniques to the data collection to the reporting to the publication. So in each stages, how the bias will be occurring in your research. Then identify and differentiate between major types of biases. So there are a lot of biases. So major biases we have to avoid so that our study will be having more impact, reliable and accurate. Then recognize real life examples of bias in research studies. Then last one, apply strategies to minimize bias. Not only knowing what is bias and what are the different major biases, you should know how to reduce these kind of biases. So first, we will see what is bias. Bias in research refers to systematic error that can occur during the design of the study, either the content of the study or interpretation. Interpretation means like data reporting or statistical analysis, everything can include, leading to inaccurate conclusion. So when a bias is there in your research, the conclusions will be inaccurate, or else we cannot depend on that scientific evidence which you are putting forward. So for your study to be reliable and more accurate, you should avoid biases. It can occur at any stage of the research process and can have a significant impact on the reliability and validity of the finding. So understanding this kind of biases and ensuring that we are reducing the biases is very crucial in to ensuring the scientific integrity of research studies. By being aware of bias and implementing strategies to reduce it, researcher can improve the quality of their data collection and many other procedures and contribute to more accurate and reliable research finding. So why these kind of biases occurs? So these bias can be occurring due to the sampling issues. So when you are doing a study, what type of sampling method you are following, or else how you are going to select your participants, that is of crucial value. You are setting up the inclusion criteria and the exclusion criteria. If you are missing any specific group, then it can create some biases. That is the major one in sampling issues. So whenever you are setting out the methodology, you have to make sure that however the sampling method you are selecting and what group you are selecting, that should be representing the general population, or else it should be generalized. The result should be generalized. So in such a way, you have to choose the sample. Then poor study design. Your research question and the study design should align properly. So whichever the study design suiting for the research question or else the methodology you should select. So if it is not done properly, then due to the flaw in the study design, you will get inaccurate reports or else results. So when you're going for a exposure and disease outcome, you should have a control group. So if you are not selecting any control group and you are just observing the patients, then that is a poor study design. So you should, if you are exposure to outcome, if you want to know, comparing group should be there. Then measurement errors. So data collection tools or scoring scales, if you are using. So while scoring, you should score every answers properly. Otherwise, it will cause measurement errors. Or else sometimes it will be laboratory investigation. So if the test is not a proper one, then it can also cause measurement errors. Or else the timely screening can also cause these kind of measurement errors. So it is very necessary that at what point of time you will be measuring that answers or else the endpoints. Then participant error. There can be multiple errors from the participant side also. Whoever participating, the study subjects can also cause many types of errors. That can also lead into the bias. Then data collection and reporting. So what is the data collection methodology? Who is collecting the data and what data collection tool you are using and how you are going to report all these results. So if there is any errors in that, that can also cause biases. Then funding and external influence. So many studies will be receiving the funding. It is it is all actually okay to receive the fundings because it is very necessity to complete many of the clinical trials or RCTs or many big research studies. So collecting or receiving funding is proper, but why you are if you are changing your study results according to the funding or any other reasons, conflict of interest or any other external influences, that can be counted as bias. So we have seen why this bias occurs and I have given some examples, but now we'll see what are the exact types of biases and how we can define each and every one bias. So first section, completely it is of selection bias. Have told you there is one issue, that is sampling issue. Because of the sampling issues, these kind of selection biases can occur. So it is an error due to systemic difference between probabilities of being included in the study sample. So what is the probability of a participant including in a control group or else the intervention group? So that if any error occurs in that, that is called as selection bias. So the exposure and outcome of the interest should be taken into consideration. This is the most common type of bias which is occurring in the clinical research, and it is mostly seen in like observation and all the other analytical studies. So it can be introduced at any stage of the research study also, because during the data collection, many times we are collecting the samples, we are selecting the study participant into control and intervention group. So it can occur in any stage. So if we are inappropriately defining the eligible population, that means if you're like doing a study in diabetic population, it is very much necessary. You should explain whether it is type 1 diabetes, type 2 diabetes, whether we are to include like elderly people or not, whether we are to include pregnant ladies or not. These are the simple examples we can see. So if you are not defining it properly, so many group of people will be included in the studies and it can cause a deviation in the result. So lack of accuracy of sampling from which group you are collecting and which sample you are representing. That is also very much important. Then uneven diagnostic procedure in the target population. That means if you are to diagnose certain diseases, if your outcome is occurring of a diseases, then diagnosis is very much important in that case. So if you are selecting different diagnostic procedure, in the case of diabetes, for one group of people you are doing HbA1c, the other group of people are FBS or RBS, then it can vary the results. So it can also cause biases. Then how you are implementing it. So once you are doing all the criterias and how you are going to sample them, how you are implementing that sampling method, that is also very important. So we can see what are the different types of selection biases. So the first one, it is volunteer biases. In volunteer biases, that happens when the participants select themselves for a study. So if a participant is worried about some kind of chemical exposure or any other kind of exposure, then they will be choosing some kind of studies. They are worried they are having exposure and they need to know how the outcome is happening or any other intervention it is there, any other treatment it is being provided. So they are volunteering themselves to be participating in the study. So it can also cause selection bias because we don't know what is the true intention behind it. Then non-response bias. Non-response bias can also be defined as or termed as lost to follow-up or else not at all reporting, showing up to the follow-up cases. So because individual who is not responding to a call, a telephone or else a follow-up visit. So they will be having different skewed results will be there. In the initial study, 1,000 participant was there and because of the non-responsiveness, like almost 500 or else 200 people have not responded and we have to remove it from the endpoint. So this can also create biases. Then healthy worker effect. So healthy people remain workers, whereas those who remain unemployed, retired, disabled or otherwise, they will be having a lot of diseases. So when you are doing a survey basis, this can happen. So you are doing a survey, you have to understand about certain diseases like ischemic heart disease or hypertension, and you are doing the survey only in the workers or else only in a healthy population, then it can also skew results. So equal balance should be there, employment and unemployment. Then only you will get like in healthy workers. So employment can be a variable and you can analyze the result based on that employability also. So in employable healthy workers, how much percentage of the people are having this disease, and if unemployment, how much. So in depression and all, it can be like seen very effectively. Then survival bias. Survival bias means sometimes when you are following a patient for a longer time, maybe for 5 years or 10 years, sometimes the patient might be like cured from the disease so early, or else the patient might have died due to some of the other reasons. So we will not be including these kind of things. So it can skew your results also. So if you're giving a treatment, some people can be like cured with that or some people can early death. So if you are not calculating, these data will be missing and this can be termed as survival bias. Okay, so I hope like selection bias is little more clearer now. So we'll go on to the next subtopic, that is information bias. So information bias is majorly happening when the data collection process is there or else like reporting is there. So results from differences in the method in which information is collected about or from the study subjects, that can be termed as information bias. We can see what are the different types of information bias. So the first one, it is misclassification bias. So in misclassification bias, when the sensitivity and or specificity of the procedure to detect exposure and or the effect is not perfect. That means when you are classifying the patient into the control group or else the disease group, you want to do exposed, non-exposed, disease, non-disease. So different like categories classifying you are doing about the study subjects. So when it is not proper, when the procedure to identify them into the disease, non-disease, or else exposed, non-exposed is not proper, then it can cause misclassification bias. Simply termed as if the person has to go in like intervention group, but because of your diagnostic procedure or else the another criteria or else some of the other error, you are misclassifying this person into the control group. So it can change the results. That is misclassification bias. Then ecological fallacy. That means when results obtained in an ecological group or else you can take in a group level, you are doing some kind of research. Okay, so sometimes focused group discussions can also be an example, or else psychological studies. So you are selecting a group as such, as a study subject, and then you are analyzing everything in as a group. But when you are applying this into an individual level, then there will be errors. So that is ecological fallacy. So if you are selecting a group and then you are following that group, the results also should represent that group. We cannot tell in terms of an individual in that case. Okay. Then interviewer bias, that is the most common one. So an interviewer knowledge may influence the structure of the question and the manner of the presentation, which may influence the response. So interview bias means, like, if a person is conducting a study and they are thinking that they need some sort of outcome, let it be positive outcome or negative outcome, in their mind they have already pre-decided like these kind of outcome I might require. So the interviewer, the data collection, that person, they might ask leading questions so that the answer receiving from the other end or from the participant will be like favoring whatever the results which is in your mind. That is interviewer bias. They know what is the intervention group, who is in the control group, and what kind of results they need. So according to that, if you're doing any bias, then it can be termed as interview bias. Then you are having recall bias. Bias means when you're doing a retrospective studies, or else if you're collecting a data from past or else a history. So the participant might not remember what happened in the past. Let it be 10 years before or 5 years before. It will be like few months before also. There is no guarantee that whatever the answers the participants are giving you, that will be like appropriate, that will be correct. They might remember, might not remember. So this is called as recall bias. Whenever you are going for a like history interview or past information you require, the possibility of recall bias is also very high. So for example, mother of a baby born with congenital disorders, so remembers every events more clearly. So during pregnancy, like if a mother of a baby, like baby is born with congenital disorder, so the mother will be remembering in each gestational period what happened, what they have like consumed, and what was the results. So everything they will clearly remember. But for a like mother with a normal baby might not remember all the aspects. So when you are asking questions to a mother with congenital disorder baby, they will be answering more clearly, more informations will be detailed, will be there. So there is a differences in the informations provided from the participant side because they are not remembering it clearly. Okay. Then reporting bias. Reporting bias means participant can collaborate with the researcher and give answers in the direction they perceive area of interest. So sometimes if a participant is there, they will be answering in favor with the interviewer, in favor with the study. So once we are giving the patient information sheet, they know the complete thing, what is the study about, why they are doing it, how it is being done, and what they will be obtaining. Like a smaller idea they will be having. So based on that idea, the participant tend to answer questions which is more towards to the like what will tell interest of the interviewer or else the investigator. So that is called as reporting bias. Then you are having Hawthorne effect. Hawthorne effect, like that means people will be acting differently if they know they are being watched. So if a person is on control group and we are we are looking into that person, we are observing that person very closely. So they will act differently. Sometimes they will act like they are very sick. Sometimes they will be acting like they are very normal. But actual truth might be different. So when any other person is observing you, you will act differently. That is called as Hawthorne effect. So it can also cause us deviation in the results because we are just observing and we are thinking that the patient is sick, the treatment is not working. So that can happen. Then you are having surveillance bias. Sometimes like an intervention and control group, it is there. Most of the things are based on intervention only. So this time what happens, we are observing the intervention group more closely. So what they are doing, how they're doing, each and every aspects of their activity, everything we are closely monitoring. But in the control group, we are in the other group or else group B, we are not monitoring them though that closely. So sometimes some ADR, if like or any other outcomes will be there in the control group, which might be missed to be recorded. So that is called surveillance bias. How we are monitoring each group of people. Okay, so that also should be in a uniform level, in the same level. We should not change any of these things. So like if surveillance monitoring means proper follow-up, everything should be similar. And what are the different types? Like major, like sampling and information we have seen. So in that also many other types are coming. So we'll see one by one. Placebo effect. Placebo effect means this is a psychological phenomenon actually. So where a patient experiences an improvement in symptoms due to the belief that they are receiving the treatment. So if you are blinding the patients, so sometimes the patient in the control group or placebo effect, the treatment is placebo, they will think that the patient is like assuming that they are receiving the treatment, and they will act that I am all completely normal now, I'm active now, I'm like cured with the disease, my symptoms are reduced. So it is kind of psychological phenomena, like, because everyone knows like mind is also so powerful. So if you are having a strong will to cure the disease, so that also will help in the treatment. So mind power is also mean, that's why this kind of placebo effect can also happen. So they are thinking that they are receiving the treatment, and they are showing that they are being normal, they are being active, they are being like cured from the disease. Okay. So clinical trials where a placebo group believes they are receiving the treatment under study. That time this placebo effect can occur. Then measurement bias. So like one example I've given already for measurement bias. So occurs when the data or the information is not accurately recorded in a research study. Sometimes that will be due to the data collection. So there is some kind of scales and you are not able to interpret it properly. Then the measurement bias can occur. Then inconsistent measurement tools, like different measurement tools you are using, or else invalid, like inappropriate measurement tools you are using, that can also cause measurement bias. So for proper answer, proper outcome, proper measurement is also very much crucial. That is the thing you are giving the data or the results. Then subjective interpretation of the data. So whatever the laboratory investigation or the value you have received, and you are while interpreting, subjectively interpreting that data, there can be changes or like errors in the measurement. So that is measurement bias. Then next one, it is publication bias. So publication bias, there are a lot of examples for that. This happens when the complete study is done, you have received the results, but the results you have received is of negative, or else it is of small study, the sample size was not significant. So that time you might not publish that kind of studies. That can also cause publication bias. Every research which is being conducted properly should be done the publication. So if it is like showing negative results, that is also very much important. So for future research can be like designed accordingly. And then if it is, whether it is small or larger, smaller research is also very much important. So whatever the like negative outcome or small or large studies, everything should be published. So when it is not published properly, then it is causing publication bias. There are different examples also. Funding bias can also happen. So you have got a result which is not in favor of the funding agency. So there are like government and non-government funding agencies and all. So if you are like received a funding from certain organization or certain people, and then you didn't get a results which is in favor of them, then sometimes the investigator might manipulate the results. That is very wrong ethically. And this is called as funding bias. According to whoever the funded, the changes in the study results can be made. And then language bias is also there. Okay, whenever you are doing a systematic reviews, meta-analysis, this can be like seen very clearly. So like most of the times when the study is published, it is not necessary that it is published in English. So whenever you're doing systematic reviews or meta-analysis, you tend to collect most of the studies which are in English language. So you are missing out the data from the other languages. Because of the language issue, you are rejecting so many studies. So that can cause language bias. Or else, like one simple example, like you are selecting the when it is in the stage of sampling. So selection bias, in when you are counting it in selection bias, you can tell that whenever data collection is done, the language which you are used cannot be understood or conveyed properly to the study participant. So because of that language issues also, there can be changes in the issues. Or else you are selecting the participants only who know English, only who know certain language. That can also miss out many information. So these can all be examples of language biases. Then sampling bias. Sampling bias is a different term which is similar to like a selection bias, but only like a specific aspect of the design. So it is when the selection of participant for a research study is in representative of the whole population. So whenever you are selecting samples, so it should be representing the whole general population. The study result should be generalizable. So you have to select a sample which is representing the whole population. If you're not doing that, then it can cause sampling issues. Moving on to many more biases. So funding bias and language bias we have like discussed now. So takes place when powerful motive support the research. It can cause bias in research, design, data collection in any stages, analysis or interpretation towards the funding source. Whatever they need, according to that, you can cater. So language bias also we have discussed, like including the English and excluding the relevant non-English studies. So that can cause language bias. Then observer bias or experimental bias. So here also, like it is also a similar type of interviewer bias, you can tell. So is when the person conducting the research allows their expectation or belief to influence the result of the experiment. Even if like most of the times when you're doing the survey and all, whatever the participant is telling, sometimes you might manipulate the data so that you will get whatever the results which you need. So that can cause observer bias, who are observing the bias might report or like document it in a different way. Okay. Then confirmation bias is also due to the same issue when they are when there is a tendency to favor or seek out or interpret and remember information in a way that confirms one's pre-existing belief. So you are having like two hypotheses in a research study, means null hypothesis and alternative hypothesis. So the interviewer, investigator need the alternative hypothesis to win. So that time they will be changing the data, or else they will be like reconfirming each and every step so that it will be aligning with the hypothesis which is in your mind. Okay, so they are not thinking about any other alternative possibility, either this or that. So the investigator should be open to all the like alternative possibilities, or whatever the like research or the result is giving you, they should be able to accept it. Then cultural bias. Cultural bias means like when cultural norms, attitudes, or preconception influences the research process. That means like sometimes for some we are excluding some type of cultural people. So when you are doing the follow-up studies or any other things, first you have collected data of many people, and then when you are going for the next stage, you are avoiding some like some certain race or some certain ethnic or some certain geographical area because of your like attitude or the cultural norms which the investigator is having, or else any other preconceptions, so which is influencing them and they are excluding their subjects. Okay, so that time also cultural bias can occur. So moving on to like the final few of the biases. Attrition bias. Attrition bias is very much important, and it is very like crucial also. That is laws to follow when you are doing an observational study and you are observing for a longer time, or either like forward studies or backward studies. So when you're doing the forward studies, what will happen? There will be different time points, right? So like T1, T2, T3, like that, you will be following, the investigator will be following the patient for a longer time. So in the first follow-up, you had like 700 patient. Second follow-up, you had like a 650 patient. Third follow-up, when it came, the data you have received is only a 450. So this is attrition bias. Because of the lows in follow-up, the results can be changed. Because like whenever disease group and control group it is there, most of the people like they didn't shown up for the follow-up is from intervention group. And from control group, most of them, 90% of the people from control group had shown up, and intervention group, there is a reduction. So there is a varying in number. And it is not necessary that the remaining people also will be having a similar results, or else they will be able to represent the general population. Then there will be a problem. So whatever the outcome or whatever the variables, the person who are remaining in the study and the person who have left the study. So there will be a changes. That is attrition bias or loss to follow. Then admission bias or Bergson bias is there. So that is a type of selection bias actually, like that occurs when studies are conducted in hospital setting. That means you're focusing on only one like a particular setting. The study design should be different. If you're focusing only a particular disease, then hospital setting is fine. If you are like surveying a community or any other thing, and when you're surveying a community and you are just collecting the data from only hospital setting, then it can cause admission bias, where the sample is drawn from admitted patient rather than the general population. So what is the need of your study? According to that, you have to choose the sample. Then instrument bias, it is coming similar to that of measurement bias. So because of the error due to the faulty or poorly calibrated or inconsistent measurement tools, there can be varying in the results. That will be causing a major error in the results. So instrument bias should also be considered. So whatever the instrument you are using should be validated, calibrated properly. Then only you should start using it for a wider population or research, or else you can have multiple like accurate instruments so that you can validate whatever the results you have obtained. Then performance bias, that is also another important one bias. So in that, systematic differences in care provided to groups apart from the intervention. Doctors give extra care to the treatment group, improving their outcome independent of the drug. So like if you're having a group A of treatment A and group B of treatment B, then the researcher need that group A's treatment should be more effectiveness, more having good results and all. So you are providing more care to that group A. So that time also this kind of performance bias can arise, giving extra care to a specific group so that the results will be favored to them. So the results will be manipulated or changed according to that, and you will get a results in your favor. So this attrition performance bias is also like very much important. So like all the biases is depend upon like what type of study design you are choosing. So like if you're doing case control studies and all, you will be having these kind of misclassification kind of things, sampling issues, all those things will be there. So when you are selecting a good study design, you can remove many of the biases which is happening. So all the biases is depending upon what type of methodology you are choosing, what type of study design you are following, and how you are doing the data collection. So if you are doing it properly, then we can reduce many of the biases. Now, design related bias. So that's one, like randomization is not there for the samples. There is no control group. There is improper sampling. Sample size is very insignificant. So these are all, these can all cause differences in the result. So these can be like together coined as design related terms. Then there is compliance bias, that is adherence bias. So if a group is receiving a specific treatment, group A is receiving treatment A, then it is not necessary that all the participants are adhering to the treatment, or else the like treatment regimen which is given to them. So some days they might miss the dose, sometimes they will not be following, they are not willing to follow the treatment. There can be many reasons, many barriers for this adherence. So if the participant is not adhering to the treatment which has been provided, that can also change the results. Okay, so everyone should be compliant towards the treatment, then only it will be giving a proper result. The study will be success. Okay, so when adherence is not there, then changes in differences in outcome is also a possibility. Then contamination bias. So there are a lot of biases like when you're conducting a study. So contamination bias is happening when like of course when there is a control and intervention group, then only the most possibility of contamination bias is there. So what happens here is a control group is there. They have a like certain diet, like whatever the usual lifestyle or usual diet they are having, they are following that. Okay, then there is an intervention group which who is receiving a proper structured diet. In morning you have to take this, in afternoon you should not eat, in the evening you should have salads. Like that, some sort of structured diet plan is given to the intervention. Okay, so the control group somehow come to know what the diet plan of the intervention group is, and for their own benefit they are implementing the diet structure of an intervention group. So that can cause contamination bias, because the structured diet plan is given to the intervention, it is being contaminated to the control group. That can change the results. Either this can be one of the example for contamination bias or else misclassification. Like due to an error, the investigator or any other the research team personnel is giving the intervention to the control group by mistake. That can also cause contamination. But basically crossover can also happen. Intervention group is taking a control wala treatment or else control group taking the intervention treatment. So both the ways contamination bias can occur, and due to this the results can also vary. Maybe it is little or more, the changes they will be there in the results. So that is also one bias. Then little least heard, that is lead time bias and length time bias. So lead time bias happens when you are screening very early. Okay. So think that a person is diagnosed with a disease at 60 years of age, and at 65 years of old they have died. Like that is the outcome of the study, how many people died due to this kind of disease or this kind of illness. So the person is the person died at 65 years old, but the screening was done at 60 years old. So only 5 years survival ka graph if you're seeing, it will be 5 years. But you're screening early, you're screening at 55 years old only, but the person died in 65 only. That end point or outcome is at of same age, but the screening time has pushed towards. So whatever the lead time it is, what is the difference between the early screening and the actual traditional symptom screening happened. So there will be differences in both when we are screening it early or early predictors we are using. So that is lead time bias. So everyone should be screened at a proper timing and proper outcome should be there. So this kind of lead time bias can happen, and length time bias, when it happens, it is like a little bit similar to survival bias. So slow progressing diseases have been screened properly. Okay, if you are going for a cancer in a broad term and you're doing some research in that cancers, so what happens, some type of cancers will be like very fast spreading. Within 1 year the patient's death can happen. Okay, some type of cancers, it will take a lot of years, 10 years, 15 years, suppose. So that time it is taking a longer time, and that is being screened properly. So there will be vary when you are taking a broad term, and then there are changes in that fast progressing and slow progressing disease. Slow progressing diseases might be like screened properly, and they will be like included in the study. So because of this, there will be biases. We have to, if you're selecting a broad category, then all the features, characteristic of the broad category should be studied, and proper screening method should also be employed for that. So if it is not done, then the lead time bias and length time bias can be possible. Then analysis, during the time of analysis, bias can happen. That is, first one, it is data dredging. That means what you're doing, you are repetitively analyzing the different variables, whatever you have collected, and then you are only reporting the significant ones. You are having a 10 set of variables. You are doing many multiple what you will tell analysis test on them, or else repeating the test. You are changing the data again, repeating the test. When all these things are done, there will be a bias that is happening in analysis during the time of analysis. So data dredging means repetitively you are doing a same test, or else in multiple variables you are doing the test and only reporting the significant ones. Then over adjustment bias is there. So adjustment of variables that should not be controlled. And means when a confounding variable it is there. Confounding means what? There is a third variable which is depending on the exposure and outcome, which is affecting the exposure and the outcome. That is confounding. So if confounding variables are there, that should be controlled when you're doing a research. So you are misinterpreting a variable and you are controlling it, which should not be controlled. That is called over adjustment. That means it can be intermediate predictors can also be an example. That a simple example is a person is smoking and lung cancer it is there. Okay, so the in between stage there will be lung inflammation, smoking, lung inflammation, lung cancer. So that is an intermediate marker. Okay, so you are misinterpreting that this is a confounding variable or some other which is not related to a study, and you are over adjusting it. You are canceling that lung inflammation is there or not, that you are not checking only. So it can skew your result also. So the variables which has to be controlled should be controlled, and we are misinterpreting a variable and we are controlling it. then it can cause bias. That is over adjustment bias. Then inappropriate statistical methods. So when it is data are of different type, ordinal data, nominal data, continuous and discrete, like there are different types of data. So in that, according to the data you are having, you have to choose the statistical method. What is the study design? What is the outcome you need? According to that, you have to choose a proper statistical method. If you're choosing an incorrect statistical test, that can also cause error in the result. Okay, so that will be providing invalid results also, which is not proper, which will not define the research criteria. So that can also cause bias. Okay, so we'll again see what is confounding now. So bias almost we have completed, and then we are going into confounding, that is also which is related to bias, because when another exposure exists in the study population and is associated both with the disease and the exposure being studied, it is called as confounding. So if confounding variables are there, then the results can be skewed. There will be changes in the results also. So it is very important to understand the confounding variables also. So confounding variables will be mostly risk factors for the disease, okay? Or else it is associated with the exposure of the study, which is very closely associated with, and we have to learn about it. It is not a casual pathway between the exposure and disease. So we have to avoid this confounding or control this confounding. How you can do this? So at design stages, if you want to control the confounding, then you can restrict. That means in exclusion criteria, many of the times you might have included pregnant ladies has been excluded, the patient with cognitive impairment included. So that kind of restriction can keep, maybe like for specific age group. So like according criteria along with other factors you can include it. Then matching. So for each patient in when the if it is there, if in intervention group a person it is a similar characteristic patient, one or more of the patient should be included in the comparison group. For each patient in one group, there is one or more patient in comparison group, so that there will be a matching of the characteristic. So if even if confounders are there in intervention group also, it is there in control group also, it is there, so you can study it properly. So like age, sex, race, all this can be confounders. Then randomization. When you're doing randomization, when you in the sampling, then that time also you can even out all the confounders. At analysis stage, how you're going to control the confounding? Stratification. Stratification means you are separating the data, like or else the group or else the population you are having into different groups. Okay, so age wise you are doing, disease wise you are doing, that is stratification. After stratification you are doing the analysis, that also you can identify and you can remove the confounders. Okay, it's the process of separating a sample into several subsamples according to specified criteria, such as age group, socioeconomic status, or disease. Anything can be the surgery, past history, anything. Then multivariate analysis. So in multivariate analysis, what happens? So statistical analysis of data collected on more than one variable. Many variables are there. Intervariable, you are analyzing the results, and for each variables, you are doing it multiplying. So for age only, you are doing, for weight, you are doing, for body fat and other criteria. So intervariable analysis. So that is multivariate analysis. When you're following all these steps, then you can control the confounding. So if confounding is there, your results will be skewed. That is kind of an error. So now we can see some like real life examples for the bias. So here is an article, selective publication of antidepressant trials and its influence on apparent efficacy. So like this is an example for publication bias. Okay, so in that what happens, they have collected a lot of studies and they have compared with the FDA review also. So that time like they have understood, when you're looking into the results part, okay, so you can see results part, third sentences, a total of 37 studies reviewed by the FDA as having positive results were published. One study viewed as positive was not published. Studies viewed by the FDA as having negative or else questionable results were, with exceptions, they either not published or published. So according to the results, like some are published, some are not published. Here in this case, like positive, one of the positive study is also not published. There can be many reasons why they have not published, but this is also one truth. This is an example for publication bias. Okay, so they have obtained reviews from the FDA for studies of 12 antidepressant agents. So they have studied for 12 antidepressant agents, and there were more than 12,000 patients in all the studies together. So this was a systematic literature search, and then they have compared with the FDA outcome. Okay, so publication bias example is this one, which is already published about the publication bias. Then this is an example for observer bias in RCT with binary outcomes. Systematic review of trials with both blinded and non-blinded outcome assessors. So in randomization, there are blinding, right? So when the assessors, investigator, or else the interviewer is blinded, there will be a change in the responses. So here they have collected studies which are blinded as well as non-blinded. And then they have seen how the results vary in between them. They have compared both. So they have observed there is a bias. In the observer bias is there in blinded and non-blinded. So always blinding is more accurate and they will give more good results. Okay, so this is another example for bias. So now we will see how we can avoid all these kind of biases. There are a lot of biases, lot of terms which I have like introduced today, and now we will learn how we can avoid these many biases. Okay, selection bias, information bias, misclassification, attrition, performance, there are a lot of, and participant related, adherence related. So many of the biases can be reduced, and if you are carefully viewing that methodology, most of the things can be reduced and we can make our study more impact. Okay, we are putting a lot of effort when you're doing a research, like from the start to the end. Like you have to do the methodologies properly. That means sampling, exclusion, inclusion, and how you are going to analyze it, how you are going to get the funding, and whether you will get the participant or not, how many participants will be allowing you, and you have to see your feasibility of data collection time, data collection tool, its validation. Many steps are there in conducting a research. So if you're putting a lot of effort in doing a research, then we should minimize maximum errors also. So these many biases can happen when you are not careful with the methodologies, with the data collection, with the reporting and publication. So how you are going to reduce all this bias? For the selection bias, I have good news. There is like a one most effective tool, that is randomization. So when you're doing randomization, the selection bias can be reduced. And then you have to do blinding also. So if blinding and randomization it is done, most of the selection bias and information bias can be reduced. So randomization, it is there like which group it is going, the selection, all type of selection bias, volunteer bias, everything. Randomization you have to do, and then volunteer bias is non-response, everything can be reduced. And then blinding, when you're doing interviewer bias, observer bias, confirming bias in to a limit can be reduced. So in blinding also, you are having single blind, double blind, and triple blinding. Single blinding, in most usually what happens, the patient will be blinded, the study participant will be blinded, so that Hawthorne effect to a limit and placebo effect can be reduced. Okay, so they don't know which group they are belonging to, and then they will be having they will be showing their true effect. Okay, then double blinding, when double blinding it is their observer, interviewer bias, or experiment bias can be reduced, because in double blinding what happens, the study participant as well as the investigator can be blinded. Double blinding means two persons are blinded, two group is blinded, either the study participant or statistical analyst, data analyst can also be blinded. But most commonly what happens is participant as well as the investigator is blinded in this study, and a lot of bias can be reduced. And then triple blinding means then the statistical analyst is the third option. They will be blinded with who is in control, and we can code the data and we can blind them. So during blinding also, we can reduce a lot of bias. Then follow reporting guidelines. You don't know like what are the proper methodology, what are the proper sampling method, or any such confusions are there. There are a lot of reporting guidelines also there. So like in reporting guidelines, when you're following, there will be a checklist. So you have to follow each and every part in that. So bias can be reduced. So if you are doing an RCT, you can follow concert. Okay. And if you're doing systematic reviews and all, then you can follow Prisma guidelines. So when you're following these kind of like validated guidelines, then you can reduce a lot of bias. Then in publication bias, funding bias, each and every person should think of it. So if they are not biased towards the funding agency, then we can of course reduce the funding. And whatever the language bias it is there, that a person, the investigator only should think of it and reduce that bias. But when you're doing a funnel plot, when you're going for systematic reviews and all, you can understand whether there is a publication bias or not. So you can simply plot a funnel plot, and then you can see whether whatever the research or articles you have selected is following in only into one area of the funnel, and one area of the funnel, like usually lower part of the funnel, if it is blank, then there is publication bias. So to understand publication bias, you can do the funnel plot, and you can try involving like many other studies also. At least to understand, you can do that funnel plot. Then disclose all the conflict of interest if you're having any. So when you're disclosing also, there, if any hidden bias it is there, that can be understood. Then you have to gather data from multiple sources. It is not necessary that if you're doing a community service, only in one specific area you are going to collect the data. Okay. But you should collect the data from multiple sources so you can like represent a whole population. So be sure to collect data samples from the different groups in your research population. Then check for alternative explanation. Try to identify and account for alternative reasons why you may have collected data samples the way you have did. So justify why you have done in this specific manner. So you should have many explanations why you have selected this sampling technique, why you have selected this kind of study design, why you have selected this kind of reporting method or data collection tool. So for each and everything, you should have a proper justification. So if you are able to find proper justification, if you are able to properly justify your methodology, then there is the least possibility of bias in that. Then you can take help from your team members also. So if you are reviewing the data once, then you show the data to the other team members also. Let them also review. So ask others to review your conclusion, and then take their opinions and what are their observations. So this will help you see things that you missed or identify gaps in your argument that need to be addressed. So these are like simple techniques which from how you can avoid all these kind of biases. Okay, so I hope bias and avoiding bias, all this concept is clear to all. So now I'm open to questions. So if anyone is having any type of questions, you can ask. Either you can post in the comment section also, so that I'll be able to answer. So identification of these bias is very much crucial. So first you should know what are the different types of biases. So now I'm sure that you might have some idea about what are the different type of biases and what actually it is, how it is being defined, and in what stages it can happen, so that you can avoid all these biases. Okay, so I have given the methodologies also to avoid the same. So you can follow those methodologies to avoid the biases, and you can make your research perfect. Okay, more perfect, more accurate, more reliable, or more validate. That can be defined. We cannot like 100% sure it is not there. Okay, so thank you all for listening to today's session.
Thank you, Dr. Hipasnath, for the wonderful session. Throughout this session, we have listened to what exactly is bias and why the bias occurs. We also have seen the importance of a proper structured and planned methodology. What is the importance of a proper study design, and what are the different types of biases throughout. We have seen selection bias, information bias, and different new terms like Hawthorne effect and etc. Also, we have seen what are the confounding factors, confounding variables, and what is the importance of maintaining these confounding variables and limiting these confounding variables in our studies. Also, we have seen what are the methods by which we can reduce the bias, such as randomization, blinding, or reporting, following the reporting guidelines, and even the publication bias. With the examples, we have seen all these things. So this session was very informative, and it will be very informative for the new coming researchers or the new researchers who are looking into carrying out their first research. Also, those who are uh, well versed in the research, they can get a good idea of bias, knowing new biases and confounding that and limiting their biases so that their study can get into a good result. Okay, with that, I think we can close the session. Thank you, Dr. Hardasna, once again. Thank you all for attending the session.